Hello friends, this is Dr. Rahul Kulkarni, cancer specialist from Pune. So today we'll be discussing in short about cervical cancer. Now cervical cancer is a cancer which arises from cervix. Cervix is the lowermost part of the uterus or the opening of the uterus, what we call it as. So any cancer which arises from the lining of this cervical cells is called as cervical cancer. Now, cervical cancer is the second most common cancer occurring in females in India after breast cancer. So, as you can know that there are substantial number of patients who suffer from cervical cancer, and that's the reason why it is important for us to know about this cancer. So, let us quickly understand what are the risk factors or causative factors for cervical cancer. The most important causative factor is a human papilloma virus. Now, this human papilloma virus is responsible for causing almost 90 to 95% of cervical cancers. And the most common strains of HPV virus are HPV 16 and HPV 18. The most common route of spread of this HPV virus is sexual transmission. And important point to note here is that nowadays we also have HPV vaccines. So we can effectively prevent these HPV viral infections. Apart from HPV viral infections, a few other viral infections like HIV virus can also increase the risk of getting cervical cancers. Apart from these viral infections, there are some other risk factors, especially the smoking, which also can increase the risk of cervical cancer, and also people who are living in poor socioeconomic strata or poor personal hygiene can also ultimately increase the risk of cervical cancer. So these are some of the causative factors. Now let us understand what are the signs and symptoms of cervical cancer. It is very important to know because this is where most of the patients go wrong. So it is important for us to know what are the presenting signs. The most common sign or symptom with which the patients present to us is postmenopausal bleeding. Now, if any patient who is menopausal and has any PV bleeding or even spotting for that matter, it has to be taken seriously. It should not be neglected. So this is sometimes, most of the times, it is the earliest sign of cervical cancer. So postmenopausal bleeding is something which has to be given serious consideration. Some of the other symptoms which also can be a presentation of cervical cancer includes foul smelling pervaginal discharge, bleeding after intercourse or pain after intercourse, or sometimes those patients who are premenopausal, even intermenstrual bleeding, that is bleeding in between the menses, can also be a sign of cervical cancer. So if anyone is suffering from or having such kind of symptoms, please consult your gynecologist or even oncologist for proper evaluation. Now lastly, let us just see how can we prevent or detect cervical cancer early. There are only two important steps. First is proper screening, and screening includes only two simple tests, that is a pap smear and a HPV viral testing. Now pap smear is a simple smear or a swab which is taken from the cervical region, and that smear is examined under the microscope for any abnormal cells. With this simple test, we can detect the cervical cancer at a very early stage or the precancerous stage, and we can increase the chances of cure with very minimalistic treatment approaches. It is recommended to undergo a pap smear testing every 3 yearly after 21 years, and a HPV testing can be taken once in every 5 years. And the second most important step is the HPV vaccination. As I already mentioned, we now have a human papilloma virus vaccine which is available, and it is recommended to be given for both boys and girls between age group of 9 to 14 years. It can be also given till 24 years after proper consultation, and after vaccination it is shown that almost 90% of the HPV viral infections are prevented, and it can ultimately in the long run reduce the incidence of cervical cancer. So friends, this was in short about cervical cancer. If you have any doubts, any queries, please feel free to connect with us for further information. Thank you.